Hello everyone, thank you for joining us. My name is Cody Blue. I am the clinic director here at Ivy Rehab located in Winfield, Indiana. With me I have my colleagues, Matt Lesniak, physical therapist, and Josh James, physical therapist. Today we're going to be talking about Ivy Rehab's ACL and Return to Sport program. We'll be joined by Dr. Omar Perez with North Point Orthopedics. So now I'm joined by Dr. Omar Perez. So a little bit about Ivy Rehab. We have two locations in Northwest Indiana. One here, the Winfield Clinic. We're located right off of Randolph Street next to the Wiseway grocery store in that strip mall. We also have another one on the 113th in Delaware next to Mullally Family and Sports Medicine. So once again, we have Dr. Omar Perez with North Point Orthopedics. He is the team physician for the Gary Railcats baseball team. He's also the team physician for Purdue Northwest and Maryville High School. So thank you, Dr. Perez, for joining us today to talk a little bit about ACL rehab and return to sport.
Thank you for having me.
So what are some of your specialties that you like to see with athletes and your ACL and then your other population?
So my specialty is sports medicine. I see a lot of sporting injuries, take care of from the weekend warrior athlete all the way to the elite athlete, as you mentioned. We take care of NCAA caliber players for Purdue Northwest. Also Maryville High School is one of the biggest schools in the area. My practice is sports medicine and a lot of shoulder surgery. I know that we have a good relationship in terms of the ACL rehabilitation because the ACL injury, it's a broad spectrum that requires intervention by doctors, therapists, and to some extent, and in some settings, the use of a psychologist when the player needs to go back to play sports. So my part is the technical part. I will say is the easy part because it just takes place in the OR. I just fix the problem. Now, the difficult part is getting that athlete back on track to the pre-injury sport level that he was before. That's when Ivy Rehab and Cody do it very well.
So for our viewers who aren't familiar with orthopedics or sports medicine, can you tell us a little bit about what the ACL is and what the ACL does?
Okay, so the ACL, I'm going to show you in a model here. So this is a model of a knee, okay? If we open up the knee, okay, deep basically in the center of the knee, there are two ligaments. It's called the cruciate ligaments because they crisscross each other at the center of the knee. Those two ligaments are the anterior cruciate ligament, okay, that goes from front to back, and the posterior cruciate ligament that goes from back to front. Now, this is the ACL. This is the ligament that confers stability from the knee going front and back, and also rotational instability. When a player injures that ligament, then the knee is considered to be loose, meaning when they are back or try to go back to play sports, the knee pivots because of absence of that ligament. When the knee pivots, it has that sensation of being loose, of being unstable, of giving out. Players mostly tells me that they don't trust the knee. It doesn't feel right. And in order for them to be able to go back to activities such as pivoting, cutting, accelerate, decelerate, that ligament needs to be intact and needs to be fixed. Otherwise, they won't be able to perform.
Great. So you talked about some of the mechanisms of injury, when we see athletes. Is there certain populations or males, females, young kids, older people that you see in your practice more so than not?
Well, in my practice, because I see a lot of young athletes, I'll say 90% of the patients with ACL are high school and college kids. You have the occasional weekend warrior like me that like to play basketball in the weekends that can have that injury. The difference is that in terms of training or rehab, the athlete, the high school athlete and the college player need to go through the whole process, including agility training, sport-specific training, in order for them to master the return to sport. The weekend warrior like me, if they do rehabilitation for about 3 months, once the range of motion and strength gets back, we still need to wait about 9 months to get to sports, but usually the patient does very well. In terms of demographic, females are more at risk of having this injury, and the reason, it's multiple reasons, but most of it is we believe that there's a hormonal cause. It has been shown that the menstrual cycle in the females and the way the hormones are dispersed in the body has an impact on the ACL strength. Also, the bone shape of the females, they have certain characteristics that puts them at a higher risk. If you add the fact that females, by definition, they're more double jointed, more loose, all those combine into a perfect storm to have them have a higher risk of having ACL tears.
Thank you for that. In these next videos, we're going to be describing our 5-step process on the rehabilitation of the ACL, some of the testing and movements we use to determine when a player or a patient is ready to return back to their sport or activity.
We're here with Krishan Christmas. He's one of my patients. He underwent an ACL reconstruction a few months ago, and then I sent him here to Ivy Rehab to start working with Cody. And now we're emphasizing on the return to sports program. If you take a look, the knee that he got injured was his left knee. If you take a closer look at the scars, I used an ACL graft, so I took his own tissue to build his new ACL. The tissue that I took was his patellar tendon, where I take a piece of the kneecap bone, a strip of the patellar tendon, and another bone plug of the tibia. Now, after I take that tissue, I reshape it into what's going to be his new ACL. Then there's another scar right here where I drill the tunnels through the bone. And then there's 2 smaller scars on each side of the knee. That's the area where I introduce the scope or the camera. Because an ACL reconstruction is a minimally invasive procedure using a camera and small instruments where we perform the whole surgery inside the knee without having to do a very big scar. So now I'm going to leave you with Cody. He's going to explain the return to sport program.
So as we start the beginning phases, before we even start the return to sport process, when they're in the acute phase, we want to make sure that there's limited to no pain. We want to make sure he has full range of motion and good quad strength and hamstring strength prior to us starting this return to sport process. And we can start the return to sport testing early on because we're not going to be doing anything dynamic. We need to be able to master the basic movement principles prior to the higher activity loads that we'll be testing on later in the progression. So we'll be utilizing some video analysis software when we do all of our movement analysis tests. The first phase that we have in phase 1 is our basic movement and static stability. So today, Krishan will be doing a double leg squat without any weight or resistance. So we'll have him do 5 squats facing the camera, and then I'll have him turn in different directions to perform 5 squats as well. When he's performing these squats, I'm looking at what his knees are doing, what his feet and ankle are doing, what his trunk is doing. Those will all get graded to see is he moving what we want him to do, is he having any instability, is he having any pain. Any pain with those?
No.
Making sure his knees aren't going past his toes, getting a good posterior weight shift. Okay. So another test in the phase 1 of the basic movement principles will be the inline lunge. So we'll have Krishan put one foot in front of the other, and he's going to be doing 3 lunges. We do about 5 reps for this. with both legs. So we'll go down, we'll do 3 of these for the purpose of today. The whole time we're using this video analysis to make sure he's moving properly, we're not having any knee collapse. Let's do the right one too. So we'll do this bilaterally. So we're going to look at what the right leg's doing and what the left leg's doing to compare limb symmetry. Not face me, do that. Anything with that? Right leg first. The next test we'll do is the single leg squat. So we'll have Krishan squat with one leg, with his foot hanging off. And during the test we'll do 5. For the purpose of this demonstration we'll do 3. So when we're using the video analysis software, we will measure with our iPad the joint angle. So when we have him face the lateral direction, we'll be able to look at his peak knee flexion. For our test, we like to see within 5 degrees of the contralateral side peak knee flexion. We also like to see a minimum of 60 degrees of knee flexion and good quad control, good knee control before progressing him to the next phase. So we look at anterior views and we look at lateral views, compare left versus right. Looking at trunk control, looking at knee control, looking at the foot and ankle. So when we start looking at limb symmetry strength, one of the first tests we do to measure the readiness to start progressing is the limb symmetry between quad and hamstring strength. So we use this handheld digital dynamometer, it's called the MicroFET 2, to measure their force output. So we'll have the participant starting in about 90 degrees of knee flexion, have them give a maximum contraction for about 5 seconds. Okay, go ahead and kick out as hard as you can for 5 seconds, and then relax. We'll later use this to calculate the quad and hamstring ratio for the strength. After testing the knee extensor quad strength, we'll move on to the hamstring strength. The participant will be lying prone on their stomach with about 30 degrees of knee flexion. I measured it already. We'll place the sensor here. All right, Kirshan, I want you to pull up as hard as you can. Pull, 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 pull.
So a key element of ACL rehab and going through phasic progressions is using objective data. We utilize the wide balance test for some objective information on how the quadriceps, glutes, and hamstrings are functioning to control the knee, comparing the right and left side, the injured versus uninjured side. So I'll have Deshaun do a single leg squat and reach in this wide balance test in 3 different directions where we compare the right versus the left. And also look for a quantitative composite score of how well someone can reach based on their leg length. So let's reset and let's switch legs. As you can tell, Krishan is giving max effort, reaching as far as he can in each direction, where we compare in each direction the injured versus the uninjured leg, but then we take a total score based on the distance reached in each direction to get an overall composite score, which shows really good predictive value of safety and injury risk.
So now we are at the start of phase 3. So we will not progress a patient until they've successfully passed phase 1 and phase 2. The next test we're going to be doing is single leg hopping. This will measure the ability to jump and land on one leg. So we'll have Krishan jump off his right leg, land on his right leg 5 times in a row, measure it against his left leg. So try to down, control it. leg. So we're looking at trunk control again, making sure that he can land within the same footprint. He's not having any kind of postural instability. Looking at what the knee is doing, if he's landing with a stiff knee, if he's landing with too much knee flexion. Any pain with any of those?
Really important aspect of ACL rehabilitation is making sure athletes can cut with safe mechanics. So an introduction to cutting, we use the agility ladder and have Krishan do Z cuts.
Another test in phase 3 is going to look at lateral hopping. So we'll have Krishan starting off, jumping off of one leg, landing on the other, and jumping back to the center. We'll do this 5 times for the test.
The next test is called a drop vertical jump. Krishan, what I want you to do is start on the edge of the box right where you're there, right where you're at. Drop down, then jump up in place and stick the landing. Do this 3 times in a row, first time facing the camera, then each adjacent time facing each side of the box. That way we capture front and the sideways views.
As we continue to test the dynamic stability phase, we're going to look at the single leg drop down landing. Krishan's going to do 1 repetition on each leg, each direction.
The majority of non-contact ACL injuries occur during 2 movements, either landing from a jump or planting to cut and change direction. So really important we look at the mechanics when someone plants to change direction. Krishan, come and do a 90-degree cut.
Another test in the dynamic stability phase is tuck jump. So we'll have Krishan jump up, trying to get his knees up as high as possible. One of the last phases of testing is your test that you're more familiar with, and this is the single leg hop series. So I'll have Krishan perform a single hop, we'll do the triple hop, we'll do a triple hopper crossover, and then at the end we'll talk about the 6-meter timed hop. So first one, we'll just do 1 hop as far as you can. So this is for length. So he lands with control, I would measure it, convert it to centimeters. Right leg. Measure that. Good. Now let's do the triple hop, single leg. 3. Stick the landing. Now we would test the right side. Measure that one. Measure that. Crossover. Measure that one. After the completion of all 3 of those tests, we would do the 6-meter timed hop test, right leg, left leg. Then we would calculate everything to compare his surgical side versus non-surgical side at the end to determine his readiness to return back to sports. Thank you for watching the ACL Return to Sport program and some of our test and measures. I'd like to thank Dr. Perez for joining us. So a couple of questions for Dr. Perez. If I suspect a ACL injury or a knee injury, what do you recommend that I do?
First of all, most of the knee injuries are pretty much subtle. If it's a knee injury that you start having swelling actual fluid in the knee joint, can't move your knee, can't put weight, those are red flags that you should seek medical attention. Otherwise, after a knee injury playing sports, I will give it 2 or 3 days to come back. But if by the time that you come back, you feel like you're not trusting the knee or it doesn't feel right, then seek medical attention for an orthopedic specialist.
Earlier we talked about the different graft types, patellar tendon being one of them. What are some other ACL graft types you use? Autograft, allograft, there's a lot of different options. Which ones do you typically use?
So I base my practice mostly on autograft, which means taking the patient's own tissue. I do around 80% patellar tendon graft, which is the one I did in Krishan. The other graft options that I use is quadriceps tendon autograft. Those are my preferences. Additional graft options is hamstring tendon, which in my practice I tend not to use because of problems with graft length and girth. In older patients that are probably in their late 30s, 40s, you can use cadaver donor graft. And they do well. They don't have to deal with the pain where you harvest the graft. But the assimilation from the graft to the body, it's a little bit longer because you're not using your own tissue. So I mostly in my practice do patient's own tissue with the autograft.
Well, thank you so much, Dr. Perez. I hope our viewers were able to learn a little bit about the ACL, the return to sport process, a little bit about you. If someone has any type of injury, since you said you see shoulders, knees, it doesn't have to be ACL specific, where can they find you? Where are your offices located?
So we're located in Monster and Calumet Avenue, and also I have an office in Crown Point, Indiana. You can call at 219-836-1060, or you can schedule on an online platform at northpointortho.com.
Thank you, and thank you for watching.